Visceral fat, the number one killer of humans. It goes, for the most part, completely undiagnosed. Your thoughts are really dictated and influenced by your microbiome. Distance running causes your body to hold on to fat because of your sustained levels of cortisol. These are people who are shredded, they're ripped. Their rate of death was shocking, was 10 to 15 times higher if they were an amateur. But if they were a professional, their rate of death, 90 to 180 times higher.
You can't replace part of the brain. Like, you
treat them the same.
Source of truth for the medtech industry.
Coexists with the puppets.
Robot understands things automatically.
Number one show in the medtech industry.
So Stryker got ahead of that and changed in the 90s, billion-dollar company. They had help up high, a lot of things.
The State of MedTech with your host, Omar M. Khateeb.
Hey everybody, welcome back to the show. Many of you know not only my interest in medtech and of course the devices and technology we use for it, but also the other side of it, which is optimization around your health and longevity. There's a lot of noise out there. There's, in my opinion, just a tiny handful of people that I personally love to follow because of the quality of content and education they provide. One of those people is Dr. Sean O'Mara. Sean O'Mara kind of exposed my lack of understanding, at least online, to the issues around visceral fat. And so we're going to talk about that and more importantly, why is that important for optimizing your health and longevity? A little bit of background on him. You know, I first found him on Instagram. You can follow him, check the show notes below, or just look up at Sean O'Mara. His work is really focused around the use of MRI to detect and essentially eliminate visceral fat, which he calls the root cause of every chronic disease. And unlike traditional healthcare clinicians, what I love about him and his content is that he really focuses on reversing aging and optimizing human performance, not just managing symptoms. And of course, there's many of us who are not in chronic illness. We don't have that many issues. And so what's left for somebody like us in order to really optimize our health and avoid falling victim to these chronic illnesses? Dr. O'Mara, thank you so much for joining us. How are you doing today?
I'm doing great, Omar. Appreciate the opportunity to come on your show and bring awareness of this form of disease inside of people. It's the number one killer of humans, and it goes, for the most part, completely undiagnosed, even though it's inside of people and it's quite evident on MRI scans. So we're really trying to get the word out and educate people. So you're one of the visionaries to find out about the importance of visceral fat and its related counterpart, fat around the heart and fat in the muscle. So really happy to be here.
Absolutely. And as we get into this concept that and some of the content, I've at least changed my perception, and I feel like belly fat might be up there in terms of how dangerous it is with cancer. Before we get into that, could you share maybe a quick 30-second on yourself? Where'd you grow up? Where'd you do your medical school and training? And then let's dive right into it. And of course, share a little bit about your practice as well.
Sure. I grew up outside the Washington, D.C. area, public educated schools. And then I actually went in law enforcement, studied law enforcement at Penn State, and then went to law school and became a criminal prosecutor. And then going into medical school, got a scholarship through the Army and trained as an emergency medicine doctor. And after doing that for probably 15, 20 years, I decided to become a researcher and found out about visceral fat and studied it for its connection to chronic disease. So for the past 13 years, that's what I've been doing, really studying the most important biomarker and biometric for health, which is disease itself inside of the body that nobody knows about. So that's a quick primer on myself, a little bit of my background, but I live and function today. My passion is to help solve humanity's biggest problem, which is chronic disease. Nothing costs us more money, nothing impairs more lives in terms of quality of living, and nothing kills more people than chronic disease. And the biggest culprit, as you said earlier, is visceral fat and its related fat depots of fat around the heart and fat within your muscles.
Got it. Yeah. And on that note, first, if you can explain to the audience, because this concept that visceral fat is really the root cause and could potentially be the root cause of every chronic disease, for people who really never heard of that, what clinically and I guess practically, what is defined as visceral fat, and why is that so dangerous in terms of our aging and how we die?
Yeah. So, what would be helpful is just showing people, what visceral fat is, because a lot of people get confused and think visceral fat is just belly fat. Well, that could be the fat on your belly. A lot of people pinch it and think that is it. But you cannot pinch visceral fat. You cannot feel visceral fat. It's deep inside of you. So the fat that people are pinching and feeling and see that's outside their body is this white stuff here, and that's subcutaneous fat. But the fat that really kills you, destroys your quality of life, accelerates aging, and ultimately brings about your early demise, meaning your death, is the white stuff on the inside. And this is visceral fat. So it's all this white stuff inside. And by the way, what we're looking at is a slice through the abdomen. So that's your belly button. So this is your front part of your abdomen where your belly button sticks up when you're laying on your back. These are your back muscles. Muscles are dark in an MRI scan. Fat is white. So this is fat within the muscles. So you can quickly see, a lot of people aren't aware of it, the muscles are becoming burdened with fat, and they always correlate to visceral fat. So as the white stuff in the belly accumulates, the white stuff in your muscles accumulate, and it causes your muscles to shrink and cause them to perform poorly. So these are the back muscles to keep you straight. And as you age, and I like to say disease, as you become older, your back gets more crooked because it gets more burdened by this fat. And it simply cannot get the job done of keeping you nice and erect and up straight. And you become weaker as you get older because of all this visceral fat, all this fat filling your muscles and fat surrounding your heart. So right away in the front part of this show, we should really be showing what visceral fat, and the problem behind visceral fat is, and people may be wondering, well, why is it so bad once it gets in there? Well, you can see it starts predominating, and it's the biggest thing. And oftentimes when I scan people, it's the largest part of the abdomen. But what it does is, first of all, it's not part of your body. It is disease that invades your body. So don't think of it like subcutaneous fat, which is part of your body, and there's a particular compartment part of subcutaneous fat that actually helps protect you from getting disease. But there's also a component of subcutaneous fat that's problematic called deep subcutaneous fat. But the problem in general with visceral fat is it's biologically active. So it's secreting all these inflammatory molecules and substances that travel throughout your body, Omar, and they cause other forms of disease. So in fact, after studying this now 13 years, I'm not aware of a single chronic disease that afflicts humanity that doesn't come from or not worsened by visceral fat. I mean, chronic disease really is best explained by the accumulation of this highly inflammatory fat inside of you. And to support that premise, people that don't have visceral fat, which are precious few in the world, have no chronic disease. They're spared from falling apart and getting disease. So the way I convinced my first radiologist to, in fact, start reporting and learning about visceral fat is I challenged them to pay attention to the fact that everybody who has a lot of visceral fat has a lot of disease, and people that have very little visceral fat or no visceral fat have no disease. They agreed that was very much the case, and it came as a big surprise for them, and is probably a big surprise for your audience here listening, that really, if you want to get rid of disease, if you have a particular form of chronic disease, then you really want to understand your visceral fat. You want to image it and you want to get rid of it. And I say image it because how do you know whether you have it, and how do you know, more importantly, that it's going away, that you're eliminating it, unless you get scanned? So I encourage people to get an MRI scan or a CT scan of the abdomen so you can see visceral fat. You can also get a DEXA scan, which will quantify it, but it gives it a numeric representation. And what we found, Omar, is that people who get a DEXA scan, or only get a DEXA scan, I should say, they just don't really do much with a number. They just have if you only interpreted a problem in your life as a number, like they give you a number for arthritis, they gave you a number for heart disease, you're just not inclined to do anything about it. Or if they assigned your car falling apart with rust and you never saw it, you just got a number, are you going to really engage in preventive maintenance on a vehicle that the only thing you understand about that problem is a number? So when you look at that car and you see it falling apart and you see it smoking or, some kind of, it's just performing poorly, then you're more likely to do something about it. And that's why we encourage people to get an MRI scan to see that disease, because once you put your eyes on disease, you're far more likely to engage yourself with change in your life. And until you see that disease, if we make recommendations, you're not likely to follow those recommendations. And that, in fact, was our experience when we worked with the National Science Foundation on trying to reverse chronic disease. Americans who didn't get scanned, and we just told them what to do, didn't do what we told them to do. But once we started scanning them and showing them, which basically amounts to like an awareness of this disease inside of them, they're confronted with it. They can't be subtle about thinking, oh, well, yeah, maybe I got this disease, maybe I don't. Now they really see it and know that it's surrounding their heart, it's invading their muscles, it's shrinking their muscles, it's filling the inside of their abdomen. And then as a consequence of being educated that way, then they started to pay attention to, and more importantly, do the recommendations that we provided them at the same time. So completely changed our attitude. We went from a startup medical practice that simply wanted to tell people what to do, and we were shocked that nobody would do it until we started scanning them. So if you're listening today, my first recommendation for you is pay out of pocket, get an MRI scan. You could do a CT scan, but CTs use radiation and MRI uses much safer magnetic fields and gives higher resolution, so you can see these areas of disease in much more vivid resolution if you get an MRI scan. And I hope down the road that we're able to work with the government and get what's called CPT codes, which is how revenue is attached to MRI scans and diagnoses. And that would allow a physician and a healthcare system to get compensated for doing these scans. And otherwise, there's no payment attached to it. Nobody likes to go do work for free, and neither does the healthcare system. So if we're going to end this scourge of chronic disease, we've got to put a system in place that attaches payment to physicians who read these scans, order these scans, and then eliminate this fat through a system of revenue. And right now, it's very unfortunate that there is no system in place to identify, to make a diagnosis, to get a scan. And so that's why nobody ever gets MRI scans unless they pay out of pocket and pay for it themselves. And so that's what we recommend. Until there's a system in place, pay cash out of pocket. Don't go through your insurance company. You can get an MRI scan pretty cheap on average for around $300 on average across the United States, which is more than reasonable given the value of identifying this disease and beginning the process to get rid of it.
Thank you for sharing that. I have a lot of questions. Like for the first one that I wanted to ask you is that definitely it makes sense. And I hope that in the future, health insurance companies see the value of preventative care. So that way they assign CPT codes and reimbursement for these things so that people are rewarded, they're healthy individuals, and taking the correct actions to prevent chronic illnesses. That aside, though, what people can do now, obviously, is pay out of pocket and go get an MRI scan. One of the companies that comes to mind, I guess, is Prenuvo. But my question to you is, if it's not Prenuvo, or are there other facilities you recommend them going to? Because one thing is getting the scan. The other thing is to have somebody actually to sit down and interpret them with them.
So Prenuvo is a great company that provides wonderful service. Unfortunately, they don't read visceral fat or muscle fat or fat around the heart. So you can get the scan done through Prenuvo, but my medical practice will read it for people. We're licensed now across the entire country. So you can go to my website, check the show notes, and we will do the reading, and we'll also put you in a program to help you get rid of it. So we I'm the founder of my medical practice, and I don't want to just read a problem. I want to solve a problem. So I think it's unethical to do an MRI scan on somebody and tell them that they have a problem when there's nothing available for them to do about it. So we created the solution. We give 2 months of coaching for people to eliminate their visceral fat, and they also get a physician interpretation from a licensed physician who works with us. We have about 9 physicians in working with our practice, and you can get a reading about your visceral fat on my website
And let me,
and
by the
learn
way,
how
let
to
me
get
plug
rid of
it.
it.
Let me plug
Okay,
that
so
website
the
just for
best
the people.
website to get
Yeah.
that reading is growingbetternotolder.com. It's a great name,
Oh, that is a good one.
growingbetterNotOlder.com. And that will allow you to choose a product we call the ultimate start. So it's the ultimate start to your new life, getting rid of this visceral fat. You get the MRI scan, we do the reading on it, and then we put you in a program for 2 months and get you in a group where you get to work with other people and get to know other people getting rid of visceral fat. And it's really fantastic.
Got it. Yeah, and for those, so aside from growingbetterandolder.com, I was going to
Growing
say,
better, not older.
oh,
Com.
growingbetterNotOlder.com. You
Yeah.
can also, for anybody's curious, you can also see Dr. O'Mara's main website, which is drshawnO'Mara.com. So something I wanted to ask about is that in following your content, I've seen your success in helping patients not only eliminate visceral fat, but do things like reversing heart disease, even type 2 diabetes and biological aging. I'm wondering, like, when you think about the protocols that you implement, what were some of the more powerful transformations you've seen? And like, for somebody who's listening to this right now, if they can't afford to do, let's say, an MRI scanner, are there some key things that you can prescribe right now that they can take action on tomorrow?
Yeah, so some recommendations that we do tell people to do, and sometimes people can do it and sometimes they can't. And the basic recommendations is we recommend eating a meat-centric diet, meaning principally meat and fermented foods. Eating that strategy, and we call that the living carnivore diet. So it's like a carnivore diet with living microbial rich foods, they're fermented foods.
So like kimchi, pickles, etc.
Kimchi, kvass, fermented carrots, probiotic, living cultured sauerkraut, even blue cheeses and yogurts and kefirs have living bacteria in them. So combining that with meat. Now, we work with people all over the world, including vegans who come to us in the United States from India and all over parts all over around the world. They get better even without eating meat if they cut out processed foods and start eating fermented foods. So that's a key distinction from other medical practices and other health influencers out there, is that I regard it as absolutely essential that people start eating living fermented foods for the microbial benefit. And then it's an interesting. You're a techie. What keeps people from doing that is their own microbiome. So literally, what people don't understand, it's not quite ready because it will terrify people, but your thoughts are really dictated and influenced by your microbiome. So literally, your degree of motivation that you have to exercise comes from the species of microbes that you have within yourself. And if you're a couch loving couch potato, you can't exercise because you lack those particular microbes. And so you'll just lay around, sit around, and won't exercise because of those microbes that are within you. So whether you'll follow our recommendations are largely guided by the amount of microbes and the species of microbes that inhabit your gut. And by the way, there are over 70 trillion of these microbes. So we're just beginning to find out at the earliest stages of what these microbes are, what they do. So basically, the healthier you live, the more likely it is that you have more beneficial microbes inside of you that have their interest, your interest in mind, and they mostly complete their life cycle within you. But microbes, this is just my theory, microbes that can't reproduce and can't complete their life cycle within you, but maybe can only reproduce it in the soil, they're working to destroy your health, and they just basically want to get you into the dirt as quickly as possible so they can have an enormous orgy, is basically what it comes down to. They can't reproduce, they can't have sex until they basically get you in the ground, get themselves in the ground. And so they're working to destroy you. So these microbes either help you or hurt you. We're still figuring it out. But if you grasp that concept, then what you want to do is get as many beneficial microbes in you as you possibly can, limit the bad ones. And basically, when you live a more healthier lifestyle, you attract and retain healthier microbes to live inside of you. And when you live in a less, or where you make an unhealthy choice, you encourage and you attract unhealthy microbes that will start living inside of you and cause you harm. So it's really that simple.
And it makes sense too, because like even, we've been finding PubMed, I think, publishes somewhere around like 2,000 papers a month just on the microbiome. And it makes sense because like if you eat a bunch of candy, you have this overgrowth of a certain bacteria that wants you to eat more candy. It'll release a neurotransmitter to cause you to do that. So it makes complete sense. I'm wondering, you had mentioned before, or at least in some of your publications, that visceral fat has the ability to help the body, like let's say, not just only fight off cancer, but also strengthen its immunity and its immune response. Like what's the pathophysiology behind how that exactly works?
Yes, the connection to cancer and immunity with regard to visceral fat is a profound one. So, what happens with, and the mechanism has been identified recently within the past about 2.5 years, is visceral fat impairs your first line, and by the way, your most important, best line of defense against cancer, which are natural killer T cells. So, these NK, for short for natural killer T cells, go around and surveil for cancer once they find a cancer cell, which, by the way, we all have cancer inside of us 24 hours a day. Cancer cells just get created, and when they're created largely through inflammation and through disease and our environments, exposure to chemicals, even stress, once they're identified, these killer T cells go and kill them, get inside of them and kill them. However, visceral fat interferes with the ability of natural killer T cells to do this, or their other mission, which is to identify other pathogens, other forms of disease, inflammation, other microbes, bacteria, and even toxins and pollen and different inflammatory substances. These natural killer T cells are like these super cops that go around and just round up the bad guys. But what happens is visceral fat distracts them and draws them back into themselves through a molecule called fractalkine, and that those natural killer T cells become unavailable to fight cancer, fight infection, fight inflammation, and basically are rendered ineffective for their mission of immunity to protect you. So visceral fat is your biggest problem that you have inside of you. And it has a very well understood mechanism of action, how it's impeding our immune system, which is so incredibly important. And so I hope other people listening today will get very motivated to find out about how much visceral fat they have, and then more importantly, get rid of it after once they find out about it.
I'm going to take a quick side quest here because you mentioned motivation. So, for me, I'm in really good shape. I'm constantly trying to find ways to enhance my strength and my mobility, etc. And so, there's a lot of people, but one specific entrepreneur, Sahil Bloom, who's like, an endurance athlete. He does a lot of long distance running. And so lately I was like, all right, maybe I should start incorporating some running. Maybe it's good for my VO2 max, etc. But is it true that you've argued that you feel that some endurance athletes, even though they're extremely healthy, might actually have an increase in visceral fat because of what they're doing?
Yeah, that is.
I love it. Yes, I see. I'm glad it wasn't just my imagination. You have a piece of content for this. I knew that. Yeah. I wasn't thinking about this.
So this
is.
So
if you can help me find a good reason not to do long distance running, I'll love it.
I'm going to dispel you from ever doing distance running again. So this is an MRI scan that we took through a long distance runner. who was 34 years of age. He ran 10 to 12 marathons a year. So he wasn't just a casual marathoner. He was a very serious competitive marathoner. He showed up at these races all over the country, not to get the t-shirt, but to get the medal. He wanted to win. And so a few interesting observations. His fat on the outside is almost nothing. The subcutaneous fat, super, super scrawny, skinny guy. But look
Guy's
at all
probably
the,
got a six pack and looking amazing.
yeah, but look at all the red stuff he has inside. He's predominantly visceral fat inside of him. And he wasn't aware of it, because if you looked at his nice lean body, you'd say, wow, he looks like he's in such great shape. And he always looked at himself in the mirror that way too. But also, this is his heart. We're at the level of his right heart, right lung, left lung, right in the middle of your lungs is your heart and the great vessels. And surrounding his heart, he had this enormous amount of fat called epicardial adipose tissue that was encasing within his heart and also surrounding his aorta. So this is very problematic. And once he saw that, he was an addicted runner, distance running. He vehemently swore off running that day. And to this day, it's been now 10 years. He hasn't run since. He has now switched entirely to sprinting. And he's eliminated his visceral fat, his heart fat, by getting off of distance running. And it looks like distance running causes your body to hold on to fat because of your sustained levels of cortisol that get increased when you jog. And after you stop jogging or doing distance running, that cortisol stays elevated. But sprinting does something very differently. It spikes your cortisol, and then when you stop that sprint, it goes way lower than where it was before you started your sprint. So it in fact eliminates cortisol. So running increases it and sprinting gets rid of it. So you want to switch, you want to run, but you just don't want to do distance running. You
Not
want
even
to
like a
run as
mile or
fast as
two.
you can.
So even a mile or two. Okay, but if you're,
sprint.
let's say, jogging or let's say slightly running a mile or two, that's problematic, because essentially what you're saying is that it increases your cortisol level and keeps it there because it's ongoing.
Correct.
So even because like when I hear distance running, I often heard that there are negative effects of distance running. Like I look at distance runners, no offense to them, and I'm like, I don't want to look like that because they're all very scrawny.
So, muscle, the cortisol is anabolic, meaning it causes an increase to fat, especially visceral fat and heart fat and muscle fats.
But what's
and
the
it's
benefit
catabolic to muscle. So it dissolves your muscle. And that's why runners are very lean and scrawny looking. But sprinters have the opposite effect. They're big, they've got muscles, and they actually increase their muscles, but they get rid of their heart fat and their visceral fat, so they look way better.
I'm just trying to understand, because everything happens in the body for a reason. What's the physiological response or explanation as to if you start running longer, your body says, okay, we're going to start creating more visceral fat? Is it mainly a reaction to the cortisol?
Yeah, I'll challenge you on your wording. Your body doesn't create it, it gets disease. So when you do something in a lifestyle that's unhealthy, like eating Twinkies is unhealthy, you get disease. Running too much is unhealthy and you get disease. If you have too much stress, you could kind of simulate what you do with distance running by getting a lot of stress. So how do we do that? We put you in a prisoner of war camp. Prisoners in a prisoner of war camp have way more stress than prisoners in jail that have exercise equipment. They've got all these programs for them and libraries. But you go to war, you go get your butt in a prisoner of war camp, you got nothing, so you shrink your muscles way more. But prisoners today, I'm a former cop, they come out, they're jacked, they look good. It's a very different. So stress, when you got a lot of stress, you lose your muscle and you put on visceral fat and this heart fat. So the same thing with jogging. It's just a number form of stress.
I love that you're reframing it, and more importantly, not just with me, but also the audience, giving us the better language to be using. You reminded me of something, and I'm wondering, I'd be amazed if you have content of this, but you might. So one of the things that was very big in the longevity and biohacking community is cold plunging. Okay. And so I used to cold plunge. And then at some point I said, I don't need to be doing this every day. It just doesn't make sense. I look at people who do like ice cold baths like daily, and they all look terrible. And part of me, I was just like, if I do this every day, I'm just spiking my cortisol. It's just maybe not a good thing. Would somebody who's, let's say, a Wim Hof, who's cold plunging in ice cold water below 30 degrees every day, is it probably likely they have a lot of visceral fat because of that high cortisol response on a daily basis?
Yeah, it will contribute to it. I do believe that it is problematic. You don't want to have a stress response, a stress hormetic too much. Really what you want to do is have brief, a fight or flight. You don't want to sprint or you want to have a fight, but you want it brief and not very long. People that, and not too frequently. If you don't really want to sprint every single day. Our ancestors didn't sprint every single day. They didn't have fights every single day. If you got to fight every single day, like a gladiator, you're not going to live as long. You're going to have more disease inside of you. So the same thing with cold plunge. I think it's too stressful of a thing. So my recommendation is to do cold plunging when you're in a fasted state, when you're fasting. And so I get my clients up to doing extended fasting over a period of time. It takes about 6 months for them to get used to it, but I recommend fasting 3 days a week. That's when you do your cold plunge. That's when you do your exercise. That's when you're doing your maximum intensity of exercise. And then in your feasting days, when you're feeding, you're relaxed, you're walking around, you're getting sunshine, you're procreating, i.e., having sex. You're much more relaxed and you're not having hormetic experiences. So feasting and fasting. And this always surprises people. And I always like to say, why? It's exactly what happens in the animal kingdom. When they're fasting, when they're hungry, that's when they have challenges. That's when they have fights. That's when they go out and hunt and basically exercise. But once they're in a fed state, it's game over. They're relaxed. They're laying around. They have sex. Those kind of things. They're not
It makes
doing
a lot of
these
sense.
crazy things.
When you say fasted for 3 days, are you talking about doing like an intermittent fast for 3 days or literally a 3-day fast?
It's a 3-day, 72-hour, no calorie fast continuously. So
And that's
for
the time that you
72,
recommend working out, cold plunging.
yep. And that's when you get it on. Get it, I mean, really get it on. It's maximum intensity exercise. It's working out to exhaustion, to failure, sprinting very as fast as you possibly can run, but brief. And, basically I exercise about 15 minutes every 3 days. I don't exercise or 5 to maybe 8 minutes a day. I don't exercise very much, but when I exercise like an animal does. When they exercise, it's a fight, it's life and death. So incredible effort, very short of breath. People will unfollow me when I put my exercise videos up, what I look like. They're like, crazy, cray, that guy is out of control. But that's how it's done in the animal kingdom. You get very
You
short
can't
of breath,
argue that. Yeah.
jack up your lactate. You got to blow off that CO2 to raise your pH because it's dropped so much. But that's what happens every single day in the wild with animals in the wild. That's why they look great, they live great, and we fall apart. We're the most diseased species in the world. So when we purpose to get our grant for the National Science Foundation, we didn't go to science. We didn't go what was going on in human beings because humans suck. We're the most diseased species in the world. Do we want to try to figure out how to be healthy from the most diseased species in the world? No. So we went to the animal kingdom and we study what happens in nature and to try to figure out, elucidate why they don't have chronic disease. They don't have visceral fat. They don't have this heart fat like we have. They don't have muscle fat like human beings have. Now, to be sure, they have a little bit. And if you're a hunter listening, well, they do. But you don't know, Mr. Hunter, what a human being's heart looks like. That's enormously, and might as well show you a picture of it, enormously encased in this highly inflammatory substance that completely surrounds the heart of human beings, and there's actually no space left in the here's a diseased heart. It's just all
It's
covered
all
with
visceral.
this
Yeah, and tasty.
inflammatory fat around that heart. So we saw what happened in the animal kingdom, and we decided that we would study those strategies, how wild animals in the wild live, for the purposes of incorporating into the lifestyle of humans. And lo and behold, it eliminated this fat around their heart, fat within their abdomen, and fat within their muscles.
Got it. Yeah, and it makes a lot of sense that that's essentially what you have. And I think also for those who might be thinking like, oh, and after I work out, I need to take in protein and stuff. I think again, the whole idea here is around eliminating visceral fat and longevity, not necessarily just because you have like you're ripped and jacked to the max. That doesn't mean that you're healthy. And I feel like there's no purpose of looking like that if it means that you have a shorter lifespan.
Yeah. So I think, the bodybuilding industry, it gets this claim they make, and a lot of people think that bodybuilders are super healthy. But recently there was a study coming out that looked at sudden cardiac death, basically sudden death in bodybuilders. And these weren't like couch potato bodybuilders. These were amateurs and also professionals. So these are people who are shredded, they're ripped, they have huge muscles. You think they're healthy. They do all these fantastic performance achievements, lifting huge amounts of weight. But remember, the one protective layer of fat, it's called superficial subcutaneous fat. They have none of that because they work to get rid of all their subcu fat to expose their muscles. And then the only body of fat that actually they have in their body is visceral fat and muscle fat and fat around the heart. So their rate of death was shocking, was 10 to 15 times higher than an averaged person, 10 to 15 times higher if they were an amateur. But if they were a professional, their rate of death, are you ready for this, Omar? This is shocking. 90 to 180 times higher. They're dropping like flies from sudden cardiac death because of this mismatch in the type of fat that they think is so unattractive is actually so beneficial, superficial subcutaneous fat, because there's a scientific explanation for this beneficial fat. It's because it's where adiponectin is stored. So if you're fortunate to be a follower of Omar's show here, write down that word, adiponectin, adiponectin. Guess who does not want you to write it down? The pharmaceutical industry, because it protects you from disease, heart attacks, strokes, diabetes, even obesity, Alzheimer's, dementia, MS. It's amazingly protective molecule that comes from your superficial fat. And unfortunately, if you're eliminating all your sub-Q fat by being a bodybuilder and you're thinking that you want to have a six-pack that's evident when you're walking around the beach, you want a six-pack that's only evident on an MRI scan. So I like to show off my stomach. I got a six-pack, but you can't see it. See
Yeah,
this
and you're
fat?
61, by the way. You're in pretty damn good shape.
Yeah, I'm actually 62, but I have a layer of fat that conceals my six pack of my dominus rectus. You can see it. I've got nice muscles on an MRI scan, but I work to preserve my adiponectin protective fat that's on my body, that superficial subcutaneous fat layer. And it's very interesting. Women, it also not only protects you from disease, but ladies, if you're listening, adiponectin helps you have an attractive face. And so women that get liposuction to get their fat off, and they think they want to have a six pack. And I'm just going to tell you, the CrossFit industry If you're a woman and you're trying to get a six-pack ab, can I just tell you, get ready to have a man face, dude face, because that's what you're going to end up with if you get a
Why is
six-pack.
that though? Why is
Because
that?
they lose their adiponectin and they lose their superficial subcutaneous fat, and
But
they
what
no
is the
longer
effect
have
on
a
the
pretty
face?
face.
But
And so they
what is the
get an inflamed look is from a lack of adiponectin and a lack of the superficial subcutaneous fat. During the Renaissance period of art, when so much art was created, statues and paintings of women were slightly cherubic. You know, they usually, because they had the most effeminate faces and because they had the most amount of subcutaneous fat. Today, women think, you know, because of marketing, you're supposed to be really thin and scrawny, but attached to your quality of life and your fertility, your reproductive capability, is this layer of subcutaneous fat that you want to have around you. And so women not only get a harsh, masculine looking face, but they get a voice like a dude voice, and they start talking raspy. If you're in CrossFit, you know what I'm talking about. If you don't know, start paying attention to those women who walk around with those little short shirts on and they're showing their six pack. Go have a conversation. They don't have a nice, pretty voice. They say, yeah, you know, I'm working out. They sound like a man. They start talking like men. I'm just calling it out. That industry
Yeah.
is promoting, it's like bodybuilding and CrossFit. You, I'm not saying that CrossFit doesn't have any benefit at all, but they're just an error when it comes to how you should look and how you should perform. They're not nailing it.
And you know what's interesting? This, you know, because I've spent post medical school and being in medtech, I spent so much time studying and kind of figuring out like, okay, like what are the most important things I can do for longevity? And I kind of like narrowed it down to two specific things. One was sleep, and the other one is like reducing of stress. And reducing of stress just made sense, but I didn't know exactly why. But the pathophysiology that you just painted, that essentially by not having high cortisol spikes all the time, etc., you're really eliminating that visceral fat, because the more that starts to build up, kind of like, I guess, like just like a cancer, it starts to build up, it'll affect all these other things in the body. And I love that you reframed it, that it's not a natural response of the body, it's a disease state of the body, and we need to
It's a
look
disease
at it like that.
response. Yeah. And the other important thing to point out is that I try to educate people about is visceral fat, heart fat, and muscle fat are really the only metrics that you could follow that have no confounding whatsoever. So confounding is error that gets introduced unintentionally from things that are distracting when you're trying to figure out what is going on inside of somebody. So for instance, glucometry. There's some benefit to glucometry, but do you see a glucometer on me? GCM, continuous CGM, continuous glucose monitor? No, because there's so many factors that influence the amount of glucose that you have in that it becomes spurious. You'd have to have a supercomputer and ask a zillion questions to figure out all the influences to try to decide if that number should be high or low. So let me give you some examples of a
I was gonna
confound.
say real quick, I think it's similar to cholesterol. It used to be like, oh, if you have high cholesterol, it's bad, but it's not that like straightforward and simple. That's kind of a similar
Cholesterol is
comparison, right?
another one filled with confounding, but glucose is one that shocks people more. So for instance, you can raise your glucose if if you think that's your glucose is too high, you can raise it eating glazed donuts, okay? Or ice cream. That's going to raise your blood sugar. But how about this? You can raise it when you exercise, when you sprint, do something good. So how do
That
you
and
know
that
when there's
also
a
means A1C,
trillion
right?
things?
That
Sorry?
also means also like when that rises, like if you're exercising, etc., you can essentially have a little bit of a higher A1C as well, right?
Yeah, so your A1C could be elevated for a number of really beneficial reasons that help you become healthy. And you're following the A1C and you think you're diseased, or your A1C is artificially low because you're doing something that drives it down low that's actually increasing your disease. So you don't want to follow numbers and blood studies. You want to follow structural disease in your body. The amount of fat in your abdomen, the amount of fat around your heart, and the amount of fat within your muscle. So let me bring this home. Whatever increases that fat in your abdomen is bad, and you do not want to do it. Everything that increases visceral fat, none of that is good. It will lead to more disease and your early demise. And whatever lowers it, whatever reduces it, is good and will improve your health without exception. I haven't been able to find a single exception to that in ChatGPT, AI, Grok, no example of that. So you just want to reduce, you want to eliminate this fat around your heart, fat within your abdomen, fat within your muscle. Everything that helps to do that is good, and everything that contributes to that is bad, and you want to get rid of it. So if they're really the biggest value to following these things is the clarity it provides to helping you understand, because there's so much confusion about is something good or something bad. And the question should be reframed, what is its impact with regard to visceral fat and heart fat and muscle fat? Then you get 100% clarity about whether you should be eliminating it or whether you should be doing it.
I love that. And it's super helpful, and like it's a really good way to frame it. And again, can you please plug the website that you had mentioned earlier? It's Live Better Not.
Yeah, it's growing better, not older.com. So you want to grow better
not older.
as you age, not just get older. So growing better, not older.com. That's where I have lots of resources available to people.
I just signed up for one of them too.
Say that again?
You have some resources on there. I just signed up for them and for one of them.
Oh,
and
okay,
I just
great.
received. And for those who are interested, we have a lot of people who read. Dr. Omar has a same title, which is a book on Amazon. But I do recommend just going to that website instead, just because you have a lot of fantastic resources there.
And if you're a C-level, like you're a C-level of a large company, I call the Chevy plan, the bicycle plan, the walking plan. It will get you there just a lot slower and not as good, is from growingbetternotolder.com. But the private charter to get there right away, to get there better, way better service, is working one-on-one with one of my doctors or myself. And you can find out how to do that, the private charter, through drshanomara.com, DRNOMARA.com. We work with the most important people in the world. We study them. I can't talk about who they are. They find out about us and they come to us. And if you want to be the very best in what you do, you want to be a better influencer, then consider going to drshanomara.com. We can't work with everybody, but we're looking to work with the top performers to study them because they have different microbes. And we learn from that from a top-down approach to be able to help out the rest of humanity.
Fantastic. And then again, for my audience who's listening, especially a lot of the reps who are interested in this, if you go to growingbetternotolder.com, you scroll down, there is a free plan that you can get that gets emailed directly to you. I think that's a great place to start. Dr. Omar, thank you so much. But I know we got a few minutes before you have to hop. We got exactly 6, so I'm going to keep you on just for a little bit longer. But just last thing for our audience, again, you shared a lot of really fantastic and actionable insights, more importantly, reframing this conversation for us. But 2 to 3 key things. I have my own 2 to 3 things I'm going to be implementing starting tomorrow, but 2 to 3 key things that no matter where somebody is when it comes to visceral fat, what they should start be doing starting from tomorrow. Your top 2 to 3 things.
Yeah, so the first thing you absolutely should start with is cut out processed foods. So eat more ancestrally. Animals in the wild don't eat processed foods. If they are near a national park or a suburb where they have access to human processed foods, then they have more visceral fat and more disease. So stop processed foods. Eat a living carnivore diet, the healthiest meat possible. Don't eat cheap, diseased food from like a mass-produced like Hormel or nothing gets that company. But you want to eat more wild game meat or grass-fed, grass-finished, super healthy meat, and then eat fermented foods. We see the healthiest practices and people that have the healthiest lifestyles and lowest amount of disease are people that eat these traditional fermented foods. So I recommend eating fermented foods. And then other recommendations I have, we talked about, is fasting and kind of hormetic exercises. So sprinting, fasting, some occasional cold plunging, and it will greatly stack together to eliminate these dangerous fat depots. We actually give people, because there's so many things, we give people 50 things to do when they come work one-on-one with us. We used to give it away free. Nobody does it until they get scanned and they stand in front of us for 5 hours with the doctor. And that's why it's expensive. You go to our website, our starting price, just to work with a doctor, one whole day, 5 hours with the doctor. It's like surgery, $25,000. It keeps going up, the cost of it, and our MRI scans and what we do, research and things. But that's your best program. You learn how to stack all these things. We do follow-up scans until that disease is gone. You'll look better. You'll perform better. You'll live better, because you will be better if you do those things.
Fantastic. Dr. Mara, thank you so much. For those who are watching, again, check out his website. You be sure to follow him. A lot of the reps, I know that you guys in between cases and everything are on Instagram. Go check out his Instagram page and give him a follow. It's one of my favorite pages online. With that being said, this is State of MedTech. If you know that somebody that would benefit from this episode, go and forward this on to them, and we'll see you all next time. Thanks for checking out this episode. If you want to do me a big favor and join so many other people who have helped grow this podcast, take a second and look below. If you're on Apple, give us 5 stars and write a short review. If you're on Spotify, just give us 5 stars. And if you're on YouTube, hit the like button. And most importantly, if you can, subscribe. We release so many different episodes that you may miss. Be sure to subscribe and turn your notifications on. You get extra points with me if you subscribe across all 3 channels. Thank you so much. And if you felt like this episode helped you, send this to somebody who would really enjoy and appreciate it. Share and spread the love. We'll see you all next time.